Thank you for asking about the Raynaud's disease. Actually, before giving the treatment, I'd like to talk about the disease itself, because actually it's not one disease. It's about three ones or three categories. The first one is the Raynaud's disease, and the second is Raynaud's phenomenon, and the third is the Raynaud's syndrome. So what's the difference? The Raynaud's disease, actually, it's a hereditary disease. It's inherited. So usually you will find one or two of the family have the same problem. And we can, what happens in this disease, that usually members of the family, they feel, when they feel cold, they start to develop these changes in their extremities. When the hand is exposed or the body is exposed to sort of cold weather, or they catch something which is cold, their hands start to have some colors. First it becomes pale or whitish, and then it becomes bluish, and after that their fingers, after they go and try to heat their fingers or their hand, their fingers return to like red color. Okay, so pale to blue to red after heating. These colors occur with people with Raynaud's. So the first category that people have is Raynaud's disease. Raynaud's disease, actually, they are people that are born with this. They cannot tolerate the cold weather. So when they are exposed to some cold, they have this problem. The causes of Raynaud's disease is not known. Unknown causes. It's just hereditary. Usually you will find some people in the family has the same problem. So when this happens, they have what is called Raynaud's disease. So this is the primary or the first type of the Raynaud's disease, which is the primary Raynaud's disease. It's unknown. Cause usually happens in families. Actually, some people move from their home places because they cannot tolerate the cold to a warmer places. This is the primary Raynaud's disease. There is another two which are both secondary. What is called Raynaud's phenomenon. Raynaud's phenomenon, it's a transient thing that happens with people that have some systemic diseases, especially collagen vascular diseases, or like systemic lupus erythematosus, rheumatoid arthritis, and other diseases. They have this problem that sometimes they have Raynaud's phenomenon happening once in a while, and sometimes it is usually not severe, but also can be severe in some cases. What about Raynaud's syndrome? Raynaud's syndrome, actually, it's also a second type of secondary Raynaud's. What happens is that these people have the problem of developing Raynaud's phenomenon when they are exposed to certain conditions like stress. They know that when they are exposed to these certain conditions, the Raynaud's happen. These also are considered to be secondary to another condition. The Raynaud's is secondary to another condition. So we have one primary Raynaud's disease, which happens usually hereditary. It's unknown cause. Actually, it's untreatable. It's where they will stay with it throughout their lives. And the two other secondary Raynaud's that happens with the secondary to another conditions, like secondary to disease like collagen vascular diseases, systemic lupus, and other diseases, and also secondary to other conditions like the exposure to cold or stress that exaggerate the condition. What happens exactly? We can see that the vasospasm that gives us the first signs of the disease happens due to some things that we can see inside the endothelium. The endothelium usually has some excretes some certain substances like nitric oxide. These substances actually cause vasodilatation, and when these substances are absent, as in patients with Raynaud's, usually vasoconstriction happens. So this is the first sign that the patient feels when the vasoconstriction happens and there is little blood coming to the extremity, and that's what gives us the whitish color, and then after that the bluish color. So what happens is in the blood vessels itself there is vasoconstriction caused by what we said now. And there is another also theory about affection of the nervous system, and there is increased release of noradrenaline in the place, and this is also causes vasoconstriction. And also there is platelet aggregation in the place, and there is some certain also substances from the platelet that causes also or increases the vasoconstriction. So these theories are about the cause of or the pathophysiology of what happens in the and causes the Raynaud's phenomenon. What happens that when the vasoconstriction occurs, that the blood that reaches the extremities will be less, and then we will see the color becomes pale or whitish, and when that happens the blood will be less and more less, and so it will be cyanotic and blue color will happen. And afterwards, when we heat ourselves or heat our hands, there will be a gush of blood to the place because we already warmed our hand, so that will lead to hyperemia in the place, and it will become red color, and sometimes it's numb or numbness happens, or sometimes it's painful after that happens. So what these are the color changes and what happens during these color changes. Now for diagnosis of the Raynaud's, actually the patient should undergo extensive evaluation in this case, because it could be only hereditary condition and that's all, but also it could be secondary to other diseases. So we should make all the blood tests and ask for symptoms and go into extensive investigations to explore if the patient have vasculitis, if the patient has a collagen disease, if the patient has systemic lupus, arthritis, rheumatoid arthritis, and other diseases. So this is very important as a first step that we diagnose this. If it is secondary to other diseases, then this should be diagnosed. Actually, if he doesn't have these things, then we have two options. It could be just hereditary only, and the patient is just sensitive to any sort of cold. And when you will ask the patient, you will find that his grandmother, his mother, has any one of the family has the same condition. Also, it could be the investigations will be negative and there is nothing wrong with the patient and he doesn't have any collagen or other diseases, but this happens secondary to other conditions like stress, like other conditions, and in that case he has the secondary Raynaud's phenomenon. Now for the treatment, we should avoid as we can the cold weather. Wear gloves, wear clothes that heat our body, and also some people move to another places that are warmer than the places that they live in, especially if they have the primary one who has only mild symptoms with exposure to cold. Also avoid smoking because it makes more vasoconstriction and worsens the condition, so it's very important to avoid smoking. Sometimes we use some drugs like calcium channel blockers or other medicines that will make vasodilatation. So we use vasodilators also together with the warming of our extremities. Sometimes some make sympathectomy or interfere with that sympathetic system, but this is not used usually nowadays. It's very efficient now to only to warm our extremities and use vasodilators in patients who have that problem. You should see your doctor, and accordingly he will see what kind and what type of Raynaud's that you have, and if there is any other systemic disease that need to be treated. This is very important as a first step, and a second step that you also keep yourself warm all the time, and if the doctor gives you some other medicines like vasodilators or others, this will help you as well.